So they are connected to global land. And this is the imaginary country where there has been an outbreak of this virus. There are many different countries that are connected to this emergency operation center. And there are many decision makers that are here in this room, and they're going to be able to speak to their colleagues to see how they can manage this particular emergency. They're going to look into taking strategic decisions. They're going to try to have a coordinated response to this public health emergency. So this is the deputy incident manager that you can see on the screen. And all the people here are in this room, and they are taking epidemiological decisions. They are here developing public policies. Now, to come back to our scenario, I would just like to remind you that there is a very first cluster that was reported on the 3rd of December. Everything is associated to the carcass of a deer that was found in the forest, and it is from this carcass that the illness spread. It evolved very quickly, and that is to say that on the 15th of December, only 2 weeks later, there were 87 suspected cases and 13 related deaths. These cases were notified in different regions of global and in 6 regions, and currently in this room, in the EOC, we are investigating non-official reports that have to do with the spread of this disease, and it has spread to 2 new regions. There was a link that was confirmed between this dead deer and the transmission to human beings. There's also a lot of awareness raising activities that are being developed, and it is within this room that everything is being decided. They are speaking about using infrared thermometers in airports, train stations, at borders, and I think that we all can remember how this happened to us not so long ago. So here we are in the EOC, once again, still at Global Land, and now we are going to come back to the auditorium of the Academy while we await the President of the Republic to get to the EOC. Now, the second pathway now is really the heart of the WHO, is the scenario room, and here you can see it on screen. Now this scenario room, the simulation room, is extremely immersive. It is 100% immersive, and it recreates all sorts of different conditions in real time. For example, you could have the same temperature, humidity. You could have perhaps some scenarios where things are taking place in a forest or indoors. It just depends on the scenario. We have some students here that were infected by this new virus that you can see on the screen, and they are getting to the emergency room of the hospitals of Global Land. Now, I would just like to reassure everybody that you can see on screen is not sick. They are not sick. This is just a drill. The participants are students from Lyon Sud Medical Facility and Lyon Est, so they are just acting, and we also have some healthcare professionals from Global Land. As you can see, they are very good actors. Now, this simulation room is divided into 3 different spaces. There's a triage area, and there is a red area for the most infected patients, and a green area where patients are in a stable situation, and a yellow area where we are trying to determine what stage the patients are at. They are trying to decide whether they have to be hospitalized or not, whether their situation is getting worse or better, whether they need perhaps artificial ventilation, some oxygen. So this is the scenario room, and I think that once the scenario has come to an end, we have to have debriefing exercises. You can see that there are screens that are 360 degrees. We can see firefighters that are going past us, and we can see that we are up in the mountains, high up in the mountains. You could also have tropical temperatures or tropical scenarios. You could have fake snow or humidity. Everything can be found and recreated in this simulation room of the WHO Academy. Now, while we await the president to join us and to while we wait for him to go to the simulation room, I suggested that we discover another flagship program of the WHO, basic emergency care. As you know, emergency care saves lives, but in many different countries, it is not available to patients and healthcare workers, and we are going to discuss with some panelists, but we are going to listen first of all to one of the very first learners of the WHO Academy that tested some training courses provided by the WHO Academy. And let us listen to her now. Yes, it's true that when we are speaking about the influx of victims arriving, what do we think about? We think about a lot of things. We think firstly about the patients. We are thinking about how we can manage all these victims that we are not used to handling at the same time. So we are going to think about how to deploy all the resources for these patients. We also want to empty out the emergency rooms. We want to manage the discharge of patients and respond to the needs of patients where we are not accustomed to doing so. During this training session, I learned a lot. First, it called into question a lot of things about our organizations, but that's also what makes the training so valuable. We really saw how to handle victims, but from a different perspective. And we asked ourselves what to do, how to move, even though the hospital, well, we can't break it. Of course, we can't shut down our department, but we have to see how we can adapt ourselves every single day according to the latest news, according to what is happening, and that is our job, and that's what makes it so interactive. This training session was very interactive, very playful, and that's what makes it so valuable. The 6 months goals, well, the goals start already at 3 months. So it's true that there are already many different practical things that we have to implement, such as the alarm, how to formalize it, how to assemble the kits. Then later on, how we will communicate within the department, train people with practical tools, as we saw during this training session. And later on, when we have the influx of victims, it's not just the emergency department's job, it's the whole hospital's responsibility. We need to raise awareness throughout the hospital. These are projects that are very ambitious.
You are now back to the auditorium with us. The head of state and his delegation are now going through the EOC room, emergency operating control room. They're getting there. We're not going to join them now. They will join us here in the auditorium in a few minutes. In the meantime, let's have a look at another program of the WHO Academy on emergency care, which save lots of lives in the world. We've got a few videos that we'd like to show you because they know what we're talking about. Let's try again. Here's the video.
Voilà, retour à l'auditorium.
We're back to the auditorium. We have been joined by two experts in emergency medicine. This is Ingrid Lardal. You're from the private sector, together with the WHO Academy. My first question is, what is the benefit for a company like yours to work with a public institution? Your company makes practice dummies for healthcare courses.
Stopped as you were asking the question, so could you repeat it in
So
English?
I will ask the question in English. So you work for the private sector.
Yes.
I think your company make some people for the workforce healthcare. So can you tell us, please, what is the relevance for you to work with public institutions such as the Academy of the WHO?
Yes, thank you. So every second death globally, that's a staggering 30 million people, die from time-critical emergencies. And that's what our company has been working towards, helping save lives from time-critical emergencies since it was founded by my grandfather over 70 years ago. So we have quite a long history, and we came to know about the Basic Emergency Care Program 2-3 years ago through discussions with WHO Academy, Terry Reynolds from WHO and others. And we learned about this tremendously impactful program that had been already by now trained in more than 60 countries, more than 50,000 people trained, and they had seen over 50% reduction in mortality from time-critical emergencies. So an amazing program, and we also hear that this is the 75th anniversary program by WHO to significantly scale up this. But then we also came to learn about the challenges in scaling up this program, and through the discussions we understood that we could be part of a solution and help a little. So we've worked with the WHO Academy and a fantastic community of basic emergency care trainers over the last 2 years to address some of these challenges for scale-up. And one is that was also shown in the video here, the hybrid version of the program. So by developing this online training, the face-to-face time could be reduced from 5 to 2 days, which is a significant time saver and cost reduction, and avoids that the health workers have to be away from their clinical practice for so long time, which we know is a key barrier. And then we've also developed a learning lab, which is very, very portable and highly affordable. And we've also committed to offering this on a not-for-profit basis because of this tremendous impact potential we see. So this will be extremely affordable, and because it is so affordable, it can now also be left in the healthcare institutions and available for the ongoing training that we know is so important, and also supports the Academy's focus on continuous learning. So we're just incredibly privileged to be a small partner in this, and look very much forward to working with WHO Academy, and all the BSc partners out there to really take this program to scale.
Thank you. Thank you so much. Miliana Gribic, you work for WHO in Moldavia. Please, can you tell us if in the country you're working in, you also have some collaborations with private sector?
Well, Dominic, let me first say that this is lifetime opportunity for me to speak about basic emergency care in front of your excellencies, distinguished guests, partners, colleagues, because I'm clinician, but I'm also public health guardian, and I truly believe that preventable deaths that still occur in the early stages of that care journey can be addressed by implementing and investing in basic emergency care. And WHO has a specific approach to basic emergency care, and this is what Academy also has. It is high value, it is very practical solution that countries can use to be better prepared to respond not only to medical emergency, but also to large-scale crisis. And this is how we contribute to global health security and to reduction of the impact of health threats. So yes, how do we work? In Moldova, we work with partners, and this is what basic emergency care actually allowed us to do. And with thanks, of course, to Ministry of Health, who is driving this agenda together with university in Moldova. We built this strong operational platform across the organization, but also with partners, local, international partners, and we use it to improve that emergency, critical, and the operative care in the country. So we also do in-hospital mentorships, we do clinical simulation trainings, we do operational research. And what is important that these trainings, and we brought in Moldova 16 trainings, international certified trainings, it is important that they are all integrated in national curricula. I'm grateful to the honorable ministers who pointed out and stressed three components that are needed for this continuous lifelong learning, and that one is competency learning, then hybrid solutions, and the third one is mentorship. And this is exactly what we are doing in Moldova together with partners.
Thank you. Thank you so much for your contribution. I have more questions for you, but just priorité au direct.
But first, we are live, as you can see on the screen. President Macron has arrived in the emergency room, and he's listening to the explanations by the different officers. I'd like to remind you that all of the people involved in this training are specialized in emergency medicine. They've got an experience in this kind of situation. They have dealt with different and demanding wartime contexts and epidemic contexts, and they're being used and showcased to demonstrate how the WHO Academy can bring its expertise to learners. You can see that some students are acting as patients, and this is what the President and the WHO Director General are looking at the moment. The WHO Academy Executive Director is giving explanations at the moment. Let's come back to the auditorium with our speakers.
For you, Lena Grbić, because I have many questions for you. I wanted to know, because you have an advocacy for the collaboration between private and public sector and for emergency care. Can you please tell us, to your opinion, if private sector could do more for you and for emergency care?
When emergency hits, we need to be all together. So it is very important to build these partnerships and, as we are saying, friendships as well. So for example, to have partners that can provide capacities, to have WHO Academy, who is really equipped now to give us innovative hybrid solutions so that we can save times. And again, one of the ministers was saying, this time is critical, not only time for training, but time for saving patients, because time is life for a patient. So getting all together and putting all our capacities and efforts into building that strength in a country, it's critical, because no country can cope alone with emergencies. Or we also have countries in this room who are facing multiple emergencies. That's why it's important to have not only good collaboration with traditional partners, but also across sectors, as you were saying, with private sector.
Thank you. Ingrid, I think you have lived the lockdown and pandemic times. Do you remember how your society had to work during this time with public sector? because we used to say that health is one, and it is for everybody, public sector and private sector. So can you remind us of the role of your society for the response, for example, in COVID-19 during those times? If you had a collaboration, for example, with public sector at that times.
So in Norway, where we are based, we worked a lot with our local hospital, for example, and doing simulation exercises like you see here to really practice and drill on the new procedures and being prepared. So that was a very local example, and that's what we worked with globally to make happen.
That is a question for you. What can we do to remember, to remind decision makers who are here, that the protection of health and care, personal infrastructure is a legal obligation and under international law, I mean. Do you think there is something to do to remind the public deciders that it is mandatory?
I'm again grateful to the stakeholders present today because they showed their commitment, and this is exactly what we wait to hear and to why we are working with them to understand that their commitment and their understanding of what we as partners can achieve together. In terms of regulations, it's exactly what I was saying about training. So when you translate trainings into national training curricula, you have it already integrated in the system. So we have to have them accredited, we have to have them certified. This is the way to go on and to proceed and to provide services. Because for us in Moldova, it was very important that we managed to train 1,400 doctors and nurses with these accredited, again I'm stressing accredited programs, also provided by WHO Academy. And we've also managed to certify 22 Moldovan experts. Moldova is a small country, so 22 certified trainers, it's a lot. And they are now deployed to other countries. So it's not only about helping one country, it's helping countries in the region and working together. So now these trainers are deployed in other countries, in Central Asia countries, and they do apply trainings and do help for basic emergency care to be implemented in their settings.
Sector, sorry, I'm always asking about the private sector, but you have someone from the private sector could do more, and what can he do more to help this emergency care?
We have lots of directors here in the room who can talk also more about working with private sectors. Yes, but working in country, again, I have to say that the collaboration with ministries of health and with government is in the first place, and we follow their specifics, their requirements, their requests, to be able also to jump onto this partnership with private sector.
Okay, thank you very much. Do you want to add something, maybe?
I'd like just to say that, you know, when we are all together here, I would like to invite everyone to pool our partnerships, to really drive the innovation that WHO Academy is bringing, as we want with this to reach to more health professionals and to more people with this life-saving knowledge that is offered by the Academy.
Thank you very much all for your contribution and very insightful contributions.
Let's get back to the auditorium. You have seen that President Macron is still in the EOC, which is the crown jewel of our academy. We can thank our experts and commend the collaboration that we've seen today, but also during the pandemic, between the private and public sectors. The WHO Academy is a training place with a platform, different courses in this building. Let's hear different learners who have taken WHO courses in these videos.
Learning in health means to me as a health professional that we accept that we don't know everything. Learning is so critical to clinical practice and my role as a physician and a healthcare professional, because it is critical to improving health outcomes and patient care. We have to accept that we don't know everything and we have to be open to continuous learning.
Great direction by different trainers who are trained in pedagogy in this emergency care center, and I personally work on the training quality, and here I find the essential key points of a quality approach to training. So this is interesting from that perspective, and we're really well accompanied by professionals from both emergency and exceptional healthcare situations. So we have this support and this guidance, which are key, but it's still very open. That is, as I mentioned, we're not just providing knowledge, we're also contributing collectively. This is a collective reflection.
It's not an ending science, because there are updates, there are improvements, there are new guidelines coming every year, every day. So it's good to have refresher trainings where people update their knowledge, their skill, their attitude. Plus, it's good to share experience among colleagues from different backgrounds to see their experiences in such platforms. No matter your background, your race, your language, but it's a good platform to come together, to discuss, to plan together. So it will give you an energy, you will feel like you are not the only person passing through those challenges. The challenges are also everywhere. The solutions come from discussions also.
During this training, I learned a lot. First, it called into question a lot of things about our organizations, but that's what makes the training fulfilling. And we've also learned how to take care of victims from a different angle. And we've asked ourselves what to do. How do we move about? We can't break down our hospital. We can't disrupt our service. So what do you do, and how do we adapt every day to what's going on? That's part of our job, and this is what makes it interactive. This training, this course was very interactive, playful, and that's also what makes it so rich. It was one of the most useful courses that I've had. In the 4th of August in 2020, we had an explosion in Beirut with general chaos in most hospitals, which were not prepared with an adequate plan to receive so many victims. We got 400 to 500 victims from the get-go, and we were overwhelmed. We could not transfer them. We could not treat victims. And so after the course, what we did is that we came back to Lebanon and we started to train in small teams in hospitals of Lebanon, so that the workers themselves could train people in hospitals. And so we spread the information that we learned with the help of the WHO. And then the WHO team came to Lebanon and also delivered this course to us and with us. We got to a point where most hospitals, roughly 90% of hospitals of Lebanon, have received the MCM training. Feedback has been very positive. Many of the hospitals started changing their plans, adapting them, or even creating new plans, because some of them did not have one. So we started visiting the facilities and hospitals to find out what had changed, with a checklist to make sure that the course had had a positive impact, and that was great.
Again, I think that as members of parliament, there's a lot of things on your plate. So taking a dedicated course and really focusing on an issue, on something that's very important to their constituents, to themselves, to make sure that they can implement the policies and the programs that they want, are fundamental to their jobs. And, you know, it's a busy life. And so if you can take a few hours or a day or however long the course is to really focus and pay attention, you're just going to be that much more informed and that much better able to do your job.
Voilà, nous sommes...
Well, back to the auditorium. Thank you to those learners, and thank you to the trainers and instructors as well at the WHO Academy, and all of the partners of this institution. So in just a few moments, the head of state will be joining us. And in the meantime, I suggest we take a short break. Stay in your seats, but we'll be back in just a few moments. Thank you. A round of applause, please. Thank you.